There's a new study that just came out on the U.S. healthcare system. And just like all the previous studies, I'm sure you can guess how this went. But the details are really wild. Hospitals in the United States charge patients as much as 1,800% more than their costs amid the coronavirus pandemic, according to a new study. The 100 most expensive hospitals in the United States charge between $1,129 and $1,808 for every $100 of their costs, according to a study by National Nurses United, the largest nurses union in the country. Overall, hospitals across the U.S. charge an average of $417 for every $100 of their costs. The average markup has more than doubled over the past 2 decades, according to the report. The markups have resulted in hospital profits skyrocketing by 411% from 1999 to 2017, hitting a record $88 billion, again, during a pandemic. The rise in charges coincides with growing hospital mergers and acquisitions by large systems, the union said in a news release. The result is increased market consolidation, which leads to higher profits and increased charges, not savings for patients, as hospital systems often claim. So this gets into a point I've made on this show many times over, and a point that I'll continue to make, which is the U.S. healthcare system is a scam on top of a scam within a scam. Everybody's screwing everybody. Everybody's price gouging everybody. You got the health insurance companies, they're a scam. You got the health care providers, they're a scam. You got Big Pharma, they're a scam. The list goes on and on. Basically, any business associated with health and health care is in one way or another screwing somebody somewhere. But when you get the specifics, it really, really, really is eye-opening. Like, this is a real slap in the face. And we've discussed it. I mean, there's countless studies on this that we could bring up. But, you know, one of the more interesting points to me is that there's a study, I believe, University of Massachusetts Amherst. They found that Medicare for All would save $5 trillion over a decade. $5 trillion over a decade. Why? Because it turns out when you get rid of the price gouging, unnecessary, for-profit, rapacious, mafia-like middleman, you save money. Yes, if somebody's no longer in the middle taking their cut, you're going to save money. And by the way, they add no value either. They add no value. They're in between you and your doctor, and they take their cut. And that's another point is, people like to slam Medicare for All and say it's going to take away your freedom of choice. What's hilarious is that it's the exact opposite. Medicare for All increases your freedom of choice because you can go to whichever doctor you want to go to. Under our current system, with the health insurance mafia, they could tell you you can't go to certain doctors because they're out of network. So this system limits your freedom. Medicare for All increases your freedom. And there's no longer a middleman between you and your doctor. You can go wherever you want. So let me give you some more facts because I think this really, really, really is eye-opening. There's a study by the healthcare data nonprofit Fair Health in the spring, and they found that uninsured coronavirus patients, or those that receive considered out-of-network care, they face costs ranging from $42,486 to $74,310 if they require inpatient hospital treatment. This gets to the point I was just making. If you end up, let's say you're on vacation and you got to go to the hospital, and so you're out of network, you can get a bill for $42,000 to $74,000, even though you have health insurance. Does that sound like a good system? We also have a survey by the healthcare research group, the Commonwealth Fund, and they found that more than 2/3 of Americans say that, quote, potential out-of-pocket costs would be very or somewhat important in their decision to seek care if they had symptoms of the coronavirus. 2/3 of Americans say, I'm going to consider the cost before going to the hospital for coronavirus because I need to consider the cost. This is not something that happens in other developed countries. If you're sick, you get help. And it's paid for via tax dollars. You don't have to worry about anything out of pocket. The RAND Corporation, which is a nonprofit think tank, found that hospitals charge private insurers an average of 2.4 times more than the Medicare rates. So again, you save money with Medicare for All and you cover everybody and you have better health outcomes. There's no good argument for our disastrous private system. There was a study published in the Annals of Internal Medicine earlier this year that found that 34% of healthcare expenditures go toward administrative costs. 34%. The U.S. spent about $2,497 per person on administrative costs in 2017, compared to $551 per person in Canada, which of course has a single payer system. 2,497 in the US, 551 in Canada. So switching to a single payer system would drive down healthcare costs by $600 billion on administrative costs alone, according to the analysis. Then we also have The Lancet. Earlier this year, they found that Medicare for All would save the country about $450 billion per year while preventing more than 68,000 unnecessary deaths. An analysis published in PLOS 1 plus Medicine. Did they say PLOS? Did they say plus? Maybe I think it's just PLOS. Anyway, PLOS Medicine, of 22 single-payer studies, 19 of them predicted net savings in the first year of the program operation, and 20 predicted savings over several years. Anticipated growth rates would result in long-term net savings for all plans. 20 of 22 studies of Medicare for All said, of course, you're going to save money with it. The Federal Reserve Survey, published last year, found that about 25% of American adults skipped necessary medical care in 2018 because they were unable to afford the cost. On top of that, 26% of Americans with diabetes have rationed their insulin primarily due to cost. So stop and think about that. We have trillions of dollars for unnecessary and illegal wars in the Middle East. $7 trillion in Iraq alone when all is said and done. $7 trillion. And a couple more trillion for Afghanistan. Trillions on unnecessary wars in the Middle East. Trillions to bail out Wall Street multiple times and to bail out corporations during the coronavirus pandemic when you include what the Fed did. So trillions for war, trillions for Wall Street bailouts, trillions for corporate bailouts, trillions for tax cuts for the rich. But no, we can't rebuild our infrastructure. We can't catch up to the rest of the developed world and have universal health care or universal college. This is what they try to tell you. They try to make you feel crazy for wanting to catch up to the rest of the developed world, to have the same thing that other industrial nations have. They try to make you feel crazy for wanting that. You're not the crazy one. What's crazy is what we're doing now. What's radical is the system we have now. We have price gouging mafias ripping you off at every turn, whether it's big pharma, the healthcare providers, or the health insurance companies. Everybody's getting ripped off. This is such a depressing thought. But imagine living in a country without universal health care, and then we get a pandemic, and the government still doesn't try to do universal health care. That's the place we're in right now. And it doesn't matter how detailed and data-oriented my arguments are on this front, it'll just be dismissed. And the sad reality is because the Republicans are all bought by Big Pharma, the health insurance companies, healthcare providers, and so are the Democrats. So are the Democrats. Obamacare was great for the health insurance companies, mandating that more people become customers of them. So you have the Democrats and you have the Republicans. They're both there to serve the health insurance companies and Big Pharma. They're not there to serve you. If they were serving you, they would have already done this. They would have already done Medicare for All, because 70% of the country wants Medicare for All, including in one poll, 51% of Republicans wanted Medicare for All. So they're not representing you. They're representing their corporate donors. But now you know. The evidence and the arguments are overwhelming that this is the way to go. You save money, everybody's covered, better health outcomes. There's no good reason to not do Medicare for All. That should be crystal clear to everybody. And, you know, if you still are not sold on it, go watch this segment from the beginning again and listen to all the data points on it. And I haven't even brought up the Commonwealth Fund study that ranked the healthcare systems of the world, and we were 11th out of 11. Out of 11 developed countries, we were 11th out of 11. And they do this study every so often. I think every few years they do this study, and the results are always the same. Embarrassing, guys. Embarrassing. We're getting screwed. It's time to fix that.